Diabetic foot care is extremely important, obviously, for people with diabetes. Diabetes can cause a condition called neuropathy, which is inherent dysfunction of the nerves. And in the worst cases, patients with long-standing diabetes actually have no sensation on the bottom of their foot. And in those cases, the smallest dry skin crack, the smallest pebble, the smallest little piece of dirt can sometimes cause an ulcer by going through the skin, causing a little bit of trauma, and then infection sets in. And of course, people with diabetes don't heal well, and they have depressed immune systems. So when you combine a foot that doesn't have normal sensation to an environment where there's poor healing, you end up with ulcers. So it's very important for people with diabetes, particularly those who have developed neuropathy, to perform diabetic foot care. A lot of times the skin in diabetics will become cracked and dry, thick and hardened, and that's because they don't sweat normally. So you need to use products like Eucerin cream and some prescription ointments and salves to make sure the skin stays flexible enough to resist tearing and deformation. And then shoe wear. It's very important if you have diabetes, especially if you have calluses, deformities, a history of ulcer, any type of contracture or pain in your foot, that you have diabetic footwear. You can have custom diabetic inserts made for you. We do that at this clinic with a 3D scanner. Typically, insurance should cover 3 pair of inserts a year and 1 pair of diabetic shoes, because the studies and the literature have shown over and over again the extreme importance of prevention. If you're in the right shoe and the right insert, your odds of having an ulcer and then eventual surgery or amputation are vastly lower. So that's another way you can do self-care. Another way is simple. You just take a face mirror, put it on the floor, and you're able to look at the bottom of your foot every day. This is very, very effective for people that don't have sensation or don't have the ability to pull their leg up and look at the bottom of the foot themselves. If they just place a mirror on the floor and look at the foot every day, they can see if they've had a crack in the skin or a pebble cut them or they stepped on something. And in those cases, you should seek care right away with a doctor. We treat diabetic foot problems all the time in this clinic, and our mainstay of treatment is offloading pressure points, because that's the #1 cause of ulceration. However, we do any kind of treatment up to and including massive and major reconstructions of diabetic feet that are deformed, where the bones have fractured and become so misshapen that you have almost a reverse arch, or what's called a rocker bottom. Those are the feet that are prone to becoming ulcerated and then are at risk for amputation. Our goal here at this clinic is limb salvage, or avoiding amputation. So we do everything we can to help diabetics keep their feet and keep their toes and keep their legs. We monitor our patients very, very closely. We maintain close communication and coordination with primary care doctors and endocrinologists to make sure the actual diabetic care is optimized. And then we do whatever surgical treatments are needed to treat any type of wound, any type of pressure point, or any type of contracture that needs to be released. We do a lot of limb salvage, a lot of reconstructive surgery here, a lot of what's called care of Charcot arthropathy, which is a fragmentation of the bone from diabetes. We put on a conference that tries to teach other providers, such as podiatrists and family practice doctors, about this condition. So we have a deep and abiding interest in the care of those with diabetes, particularly with these major foot problems.